My name is Dr. Richard Martin. In addition to regular board certification as a general orthopedist, I also have a specialty board certification in sports medicine. It's a new board certification that just came out in the past 3 to 5 years. In addition to my regular orthopedic training, I also did a fellowship training under Dr. Richard Stedman from the Stedman Hawkins Clinic, who is a world-renowned orthopedic surgeon. When talking about the recovery from rotator cuff surgery, the recovery is not faster if it's done arthroscopically. To return to unrestricted lifting, pushing, or pulling, it's still about 4 months regardless of whether this is done arthroscopically or open. In most cases, when we do find that a patient has a rotator cuff tear, it's usually the result of an acute event. Other patients who present with shoulder pain, when we do the examination, we usually find that it's more of a tendinitis. And when we're evaluating the patients, the history obviously is very important when we try and determine whether or not this truly could be a rotator cuff tear. Physical examination also is very important, particularly manual strength testing. When comparing postoperative pain in arthroscopic versus open surgery, typically the first 24 to 48 hours there is a difference, with that being more severe with the open procedures. Fortunately, the anesthesiologists are able to do regional blocks that can help alleviate some of this discomfort. Most rotator cuff tears can be approached arthroscopically. However, there are some procedures that involve other parts that require a small open incision. And in those situations, sometimes it's better to just proceed with the entire surgery through an open fashion. What's exciting about arthroscopic surgery is really in the past 5 to 7 years, the technology has significantly improved, as have the techniques. Initially, we were using metal anchors, which posed a whole set of problems with detection on MRI scans should injury down the road occur. Nowadays we have implants that either are dissolved by the patient or act as templates for bone to grow into them. There is such a thing as an irreparable rotator cuff tear. These most likely started out as small tears that were either missed or neglected by the patient. Over time, these tears get larger, and as they get larger, what happens is the muscle starts to contract. This pulls the tendon away from the bone and prevents it from healing. Over time, this contracted muscle then starts to become replaced with fatty tissue, and you start to lose the contractile ability of the muscle. When you get into that scenario, going in and just trying to pull that tendon back to the bone is not going to solve the problem. And in many instances, the treatment involves a specialized shoulder replacement surgery.